Hi, my name's Sean Dowdall. I'm the Charity Director of Soft UK, and today we're in the lovely Huddersfield, which is bright and sunny, visiting Forget-Me-Not Children's Hospice. This is all part of Soft UK's Change the Narrative campaign, which is about changing language and perceptions of different parts of the journey that would affect a Trisomy 13 or Trisomy 18 journey, but also a broader spectrum as well. And we've been welcomed into Forget-Me-Not Children's Hospice today, and we can't wait to see what happens here, behind the scenes, with the staff and some of the families as well. So let's take you inside.
And then
Don't let me sing that song.
go on, do it.
It's all about you.
I don't know how we could have got through everything without coming to those groups, to be honest.
Oh, sorry. I was going to say hi.
Yes, that's right. This is just a lovely, lovely place. That we always feel better for being here. Yeah.
Before we meet the team, we were given a quick tour of the hospice, starting with the gardens and all of the amazing outdoor space that's available for families to use when they need it. So this is the Forget-Me-Not garden, and basically it's run entirely by volunteers and just one worker, and it's an absolutely incredible, amazing space. It's so quiet and peaceful, and there is so much here for the children and families to be able to do. Over here we've got this, which is absolutely beautiful. It's the remembrance tree, and we've got all of the names here to be remembered with these beautiful blue flowers on them and this lovely white tree as well. They're absolutely lovely. They're this like slate material, and they've been made in a way that they don't fade now as well, which I think is absolutely fantastic. And this is just one part of this absolutely incredible space. So if you follow me, we'll go and have a look at some of the other amazing bits in here. So as you can see, there's absolutely loads of stuff here, and this is just the outdoor space. We've got all like the different play areas. There's a whole place for like planting. We've got a whole nature bit as well with all these really random little animals. So we've got a chimp here, we've got this sheep. There's so much going on out here just to keep the children and families entertained. It's a really, really lovely place. We've got swings, we've got a big old pirate ship there, there's a picnic area. And like I mentioned at the start, it's so peaceful. It really is quiet here. Before we move on to view the rest of the hospice, we got the chance to speak with some of the team who kindly took the time out of their busy days to let us know a little bit more about what they do.
Hi, my name's Faye, and I've worked at the Forget-Me-Not Children's Hospice for 12 and a half years.
My name's Carol Cairns, and I've worked at the Forget-Me-Not Children's Hospice for 12 years and 3 months.
My role is I'm a family support practitioner.
Faye and myself work together along with Tara, who you'll meet later, and we are tier 1 of the family support team. So whenever a referral comes into this hospice for end of life or a bereavement, it will come to us straight away, and we will react, visit and help with supporting the family.
It's a very responsive role, isn't it?
Yeah.
Yeah.
So I'm Rebecca. I'm a trainee nurse practitioner here at the hospice.
I'm Emily, and I'm the care coordinator for the 0 to 5 children.
I'm Kerry, I'm the care coordinator for 13 to 21.
And I'm Holly, I'm care coordinator for 5 to 12-year-olds.
My name's Megan. I am one of the children's nurses here at Forget-Me-Not Hospice, and I work downstairs in the care team with the children.
So yesterday we had the Rainbow Baby Group, and my goodness me, we had 20 babies, 20 mums, and it was like a conveyor belt using the hydro pool. It was absolutely delightful. Yes, so my day started off not knowing I was doing that, but that's what we did do. And it was so much fun. Yeah.
The day in the life of what? It's really epic.
So I feel a day in the life for us is very varied. No 2 days are the same.
We have to be very responsive, so we manage our own diaries
Yeah.
and prioritise children that need to be seen depending on their clinical wellness. But that can change on arrival to the hospice, and we respond to families that are in a crisis period or their child is medically unwell.
Yeah.
And that can range, can't it, from going out to the hospital to support the families, that can be in their home, it can be bringing them here if they need that extra support and want to be here. It's kind of what the families need at the time, isn't it?
Yeah. I feel like we're very led by families, so some families will want lots and lots of support, some families will just want us when they need that support and dip in and out of that support, so it's different for every family as well.
Yeah, and I think we personalise what we offer families here as well. Like Emma said, every family wants different from us as a team. So it might be that they've got involvement from the care coordinators, or it might be that we need to do joint visits as well with the advanced nurse practitioners. And it can just vary from day to day, can't it?
Yeah.
I think we respond to families in a really holistic way, not only medical as well.
Yeah.
And just meet the needs of what they need on that day and their journey through the life of their child.
Every day is super different here. We have lots of children come and go every day, and they come for respite, and we mainly support a lot of that. And every day it can be quite chaotic. We do lots of activities. That is what we try and promote here with the children. We do lots of memory making. Families love to see that. We do a lot of, we can go in the pool, we can go in the garden, we can go out and about to local farms, and the children love it. We just tailor it to that child, whatever child is in for respite that day. Some children don't like going outside, so we do a lot of sensory or pool, or if they like going out, some children just love being in a van, which is strange. So we just love to go in the van and drive and probably end up getting some food.
So we are a will-do sort of team. We're not fazed by much, are we?
No, not at all, no.
As you say, you
No.
come in and you think you're doing one thing and the next minute you're going to Sheffield to pick a baby up.
Yeah,
Or we do a walking group.
we do.
We do a dad's bereavement group, but they didn't want to call it a bereavement group. They wanted it to be peer support, not structured. So they've called themselves the maintenance crew. So they came in one Sunday and they looked at the garden and they said, oh my goodness. So I think there was 4 dads and myself. So one of them's a tree surgeon, and he said, right, put us all to work. I was blowing the grass back on. Someone was trimming, someone was mowing, and it was lovely. And then we had a bacon and egg sandwich afterwards.
And can I just say I did it on Sunday, and I also had well, I'm a vegetarian, but I did have an egg butter. It was eggs.
Now we move inside to explore the incredible spaces inside of the hospice, starting off with the main area where families come together to talk, have some food and a drink, and the children can play. There are plenty of toys and activities available here, but there's so much more to be seen in the next room. So we're currently sat in the cinema room, and this place is amazing. So families can call ahead of time and book this out for themselves and the families, bring their own snacks, they can get help providing snacks as well. And it's got this massive cinema screen up here, which is incredible. But there's loads of other things as well to entertain the whole family. So we've got a VR headset, PlayStations, Xboxes, there's DVDs, computers, the whole lot. So again, it really emphasizes just how much this just caters towards not just the family in that direct position, but the entire family. It's everybody, and it's such an entertaining place. There's so much going on here. So now we're in the soft play room, and this is absolutely incredible. It's the same thing again as with the cinema room, so families can call ahead to book this out and come in with the families, and there is so much going on here. We've got all of this play, and it's making me want to dive right in. It's really colourful, it's so bright in here, all the paintings on the wall and everything. There's comfy seating as well for families, which if you've ever been to a soft play before, it's normally really hard plasticky seating, so it's lovely to have that there. And again, just so much going on. We've got the hoist system as well, which for families who need that is absolutely life-changing and just enables everyone to be able to access this space. So yeah, this looks absolutely incredible. So now we're in the creative therapy room, and this is another incredible space. There, as you can see, I'm surrounded by instruments all over the place, so children and families can come in here and just be creative together and do a lot of play therapy. There's so much happening here. You can make music, make noise, and just have a lot of fun together. As well as these rooms, we also have the hydrotherapy pool and the sensory room, 2 additional areas for children and families to enjoy themselves in the ways they want. Now we move on to the rooms available to families. The rooms are like a home away from home, giving families privacy and space when they need it. We've got some incredible families to speak to soon, but before speaking to them, we speak to the team again to ask them what they'd like families to know about hospice care.
Hi, so my name's Michelle. I'm one of the nurses at Forget Me Not, and I'm also the senior coordinator, which means that I have an oversight over the care team and also over the caseloads and our children that we have on them.
So I'm Stacey John. I'm a family support team leader here at Forget Me Not Children's Hospice. I'm also a counsellor here, so I feel quite honoured that I get to not only lead a team of amazing people within the family support service, but also hold a caseload.
So I'm Sarah, I'm the perinatal midwife that works here at Forget Me Not Children's Hospice, and I've been here since 2017, and it's a really strange thing to say, but I absolutely love my job. I love the positive impact that we make on families, the working that we do with other people within the healthcare services and other charities, and hopefully the impact and the positivity that we bring to these families along such a difficult journey.
Most parents, when they walk through the door, are surprised at what they see. It's very happy, it's very noisy usually. We have lots of things going on. Sometimes on the quieter days it can be very quiet and appear like there's nothing going on. That's usually because we're out and about with the children doing various activities, or we have various rooms within the hospice. So we have like the cinema room, the hydrotherapy pool, the soft play area. But yeah, we would describe ourselves first and foremost as happy, which is a bit of a contradiction, I think, to how people would see us and perceive us. But yeah, definitely come and see us, come and meet us. We are not upset by any questions that you have to ask us. We would rather that you asked than kept it to yourself. Any worries, we're happy to explore those with you and to help in any way we can.
So I like to describe it as families come here to live and to make memories and to have that sort of experience where they can be excited to come to Forget Me Not, but they also know that they're going to receive some really great support as well with the journey that they're on.
It is not a sad place at all. I know that is the stigma, but we are here to just make the best memories that we possibly can for their child and for the family, siblings, aunties, uncles, whoever wants to be involved.
We try and support those families at different points in their pregnancy because everybody needs something different at a different point. Families that come to us, we're so keen to let them know you're not just a name, you're not an NHS number, you're not a family with a baby with a condition, you are a whole family that we want to look after holistically. We go home knowing that something really, really small has made a massive impression on a family. And one of the things that I talk about when we go to universities and speak, it's the things that we remember. And I remember supporting a mum who was pregnant and she was about to get married and she knew that a baby was going to sadly die and she wanted to incorporate him into the wedding. So she fell pregnant very shortly after her baby had died, and at the wedding she'd had wedding dresses on that she'd tried on with the baby that sadly died because we set that up for her, and it was such a different thing to do. And nobody at the wedding ceremony knew the relevance of the dress until they mentioned it in the evening do, and it made such an important, it was just life-changing for them. So it's the fact that families trust us and allow us to do things and try things that are outside the box. And that's what we need to do. We need that family to know that they come here and they've got that safety net.
I would want people to know, if they were thinking of using the hospice, that it's not coming at the end when you're dying, it's coming here and living until you die, and having all the facilities that we have, the support that we have, and also being held, because if you have to deal with this situation on your own, because I remember before this hospice was built, there was no respite for families in care with our life-limiting children. So when this came around, or was donations and was built, it's a lifeline for some of our families. And because we have 24-hour care, if the family is really struggling late at night, they can ring the care team and get some advice and some support.
It's beautifully put.
Thank you for...
That's okay.
After speaking with the team, it was time to meet some of the families who have used the service available at the hospice. Today, they're all coming together to take part in a Rainbow Baby playgroup, which involves lots of toys, bubbles and plenty of laughter.
Okay, so my name's Louise, and this is Michelle, my wife, and this is our son Rowan.
So I'm Emma, and we're supported by the hospice because we had a stillborn son, Toby, in August 2023.
So I'm Beth. I began my Forget Me Nots journey in May 2023 when my little boy Joshua passed away very suddenly. I gave birth at 18 plus 6 weeks. So I promised at home, so basically my waters went, but I gave birth to them intact and ended up in hospital.
I'm Carly, this is Ada, and yeah, she's got an older brother, Bill, who's 5'2", and her dad, Gary.
I'm Rebecca. We got referred to the hospice because we had a baby that was in neonatal care last year, and she passed away at 16 days.
So yeah, in terms of getting involved with hospice care, as soon as possible, it was just amazing to have the space to talk about all of our options, all of the possibilities of what could have happened with Iris, and just to really sort of think it through and be supported with whatever outcome that happens. So in the hospital, everyone's lovely, but they have short appointments. We got brief conversations with midwives, brief conversation with a consultant where they laid out our options.
My 5-year-old son can come here and talk about his brother Toby, with people who understand. And when he comes and says, "My brother's dead," people don't feel uncomfortable. They know what to say to him, and he's surrounded by other people who have been through something similar.
And I started coming here probably in the July. And I think my referral wasn't made for quite a while, and then I made the decision to make a referral, and my recommendation would be for mums that have had a loss to get referred quicker. I had quite a lot of medical trauma after I had Joshua and was back in the hospital. I hemorrhaged, and I think if I'd had the support from Sarah, I would have known my rights a bit more and been able to stand up for myself.
I mean, for us, it's a safe place. Oh, I'm going to cry. I think when you get when you get a diagnosis that's like life-changing for your child, and also life-changing for you, it's very isolating, and no family can, even immediate family, don't really understand quite the extent of it. It's new to everybody, and friends certainly just can't really relate. So to us, it's just been a massive safe place for us. Like, we can walk through the door. Any medical equipment that you've got, anything with your child is just acceptance. You walk through that door and you just feel totally safe. Yeah, it's been really good for us as a family. It's been super welcoming.
So we got referred here just for some support, and first thing we did was, I can't remember the name of the group, but I came with some other mums, and there was a dad there for some like bereavement support, and that was really nice. And then I luckily got pregnant again, and then I was at a group for mums and dads that were pregnant again after loss. So that was good to have some support with other families that have been through a similar situation, obviously not the same situation, but unfortunately gone through some form of loss. which was really useful. And during that time, I'm sure I won't mind me saying, my partner was then referred for some counselling, some one-to-one, which again was done by the hospice.
I think we were never going to have memories of our daughter after she'd been born, so everything we did with her while I was still pregnant with her, that was all that we had to hold on to, so everything was really important to us.
And then when I fell pregnant with Willow, Sarah came with me to a lot of my appointments because I had quite a tricky pregnancy. I ended up with a cervical stitch very suddenly, but Sarah came with me to my appointments for my cervical lengthening scans, and I was lucky that in the appointments that we went to, everything was fine, but if things hadn't have been fine, I would have had her there, you know, and you can take family, but having that experienced member of staff who's your friend, like feel like you're your friend, come with you and be able to say, oh, that's great, or this is what this means, or, you know, just to talk through things afterwards.
The other thing that really made that a precious memory was the music that we had by the music therapist Alice, who put Iris's heartbeat to music that we chose, and she also composed a little extra piece. And so we were listening to that, and it really helped us feel connected to Iris, and I think that was what we were really needing around that time, was to feel any kind of connection that we could to her while she was still with us. And again, that was not something we would have ever thought of doing, but because it's here and it's offered, we went with it, and it was an enormous comfort. And we've, you know, listened to the music since, and when we buried Iris, we played the same piece of music, and yeah, it gave us sort of that continued comfort that was just really important. Amongst all of the many other things that are going on in our life, like this was a place where we'd come and we were just Iris's mummies for a while, and that was, you know, that was really special.
Yeah. This is our happy place. It's our safe place where we can just come and know that everybody understands and everybody knows our story. We don't have to explain anything. We can just be here and be happy.
So I think people think you just come and you just do counselling, but it isn't. It's so much more. It's a community. It is a massive community, and I think being able to come and just, I don't know, be part of that is really special.
And it allows us to meet other families and other parents that are, you don't have to have the same conditions that you're dealing with. I've never met anybody with the same condition as Ada in this environment, but you're all living a medical life, and you can all connect and you can all share.
People don't know how to react when you talk to them, and here it's just so open to be able to talk to that, and I don't know what I'd have done without the support here, or what us as a family would have done, because, well, I always just refer to them as like actual angels, which you don't actually know, but you do now.